Hello everybody, my name is Dr. John Lucio and I practice integrative medicine and pain management in Jefferson City, Missouri. And this is my wife.
Hi, I'm Dr. Jennifer Su and I'm a private practicing OBGYN in integrative medicine as well. We upload one video a week dealing with different medical topics from an integrative medicine perspective. If you have not subscribed to our channel, we'd really appreciate if you do so. And if you like our videos, please give them a thumbs up. This video is going to be divided into two parts. The first part is an integrative medicine approach to prevention and treatment of caregiver strain. And the second part is the integrative medicine approach to prevention and treatment of job burnout.
Because of our aging population, it's going to be very likely that many of us are going to be caregivers at some point, and that can lead to caregiver strain. And what it is basically just the emotional and physical strain that it puts on people when they are caring for somebody else. There are some risk factors that you probably need to be aware of. If you're female, if you're actually putting in a lot of hours, if you have baseline depression, if there are financial difficulties, if you're doing it not at your choice, it's actually being thrust upon you, that also puts you at risk. There are some specific symptoms that you can probably feel in yourself if you are a caregiver and you are feeling stressed. We're at number one, you're starting to feel more depressed and irritable and angry. Are you gaining weight or losing weight than you were from before? Are you ignoring your own medical needs? Finding that you have insomnia, your sleep patterns are altered. Also too, caregiver can actually be at risk for increasing alcohol and drug use as well.
This type of strain on you as a caregiver is actually very pro-inflammatory to your brain that lead to depression. It's a progression. You don't start with this caretaker strain. It's very gradual over time, and if you can recognize that you're at risk for it and that you're having some symptoms, you can actually prevent it. Most of the time when you're taking care of someone, it's such a long journey that you really have to prepare yourself and pace yourself.
And it's okay to feel sad and even guilty sometimes, but that's a normal thing.
I want to talk about whether when you have realized now, I think I am having this, I'm getting kind of angry about my grandma being unreasonable and spitting up her food, and I didn't used to be. I think it's very important to talk about it with someone, whether it's your spouse or your family or a doctor, and ask them for advice. And lots of people can offer help. There's lots of organizations that can provide rest, so they're called respite care. They can give you a 2 to 3 hour break. Just 1 2 to 3 hour break for you to get away and get outside into nature, breathe, breath work, right, to eat an anti-inflammatory diet as much as you can, even though you're in the car all the time, traveling to and from, taking care of one of your loved ones. Because a diet that is anti-inflammatory will help prevent depression and anxiety and other medical problems. The other things that you can do is saying out loud these words, I am in a state of well-being, because you are. Even though you're exhausted, your heart's beating kind of funny, you haven't slept in months, and you don't know when there's an end in sight, you are not dying. You can say to yourself, I am in a state of well-being. You have to say it out loud, and when you hear it, you actually do feel better. It's really important that you learn some kind of breath work, whether it's mind-body techniques, autogenics training, yoga, meditation. All these help you decrease your cortisol levels. If you can decrease your cortisol levels, everything in your body and inflammation can be prevented. So do you want to teach them the 4-7-8 breath or the square breath? Which one do you want?
Well, we can do the 4-7-8 breath. 4 counts where you take a deep breath in through your nose, and then you hold it for 7 count, and then you slowly let it out through your mouth, 8 count.
You want to do 4 cycles of that continuously, so you know how it looks, and we'll do 4 cycles. You'll do, you said, twice a day. Okay, I'm ready.
Ready? 1, 2, 3, 4. 1, 2, 3.
Can you
4,
count quicker?
5. Sweetie, we don't have to do every count. They're
no.
going to get bored. They get it.
Bored.
They get it.
Jack,
You say you do it 4 times.
please do it 4 times.
Okay. 1, 2, 3, 4. 1, 2, 3, 4, 5, 6, 7, 1, 2, 3, 4, 5, 6, 7, 8, 1, 2, 3, 4, 1, 2, 3, 4, 5, 6, 7, 1, 2, 3, 4, 5, 6, 7, 8, 1, 2, 3, 4, 1, 2, 3, 4, 5, 6, 7, 1, 2, 3, 4, 5, 6, 7, 8, 1, 2, 3, 4, 1, 2, 3, 4, 5, 6, 7, 1, 2, 3, 4, 5, 6, 7, 8.
It's really, really important if you can do that twice a day. It's like a vitamin. You're going to do that every day no matter what, twice a day. That alone lowers your cortisol levels so much twice a day. The effect is actually gets stronger and stronger as you do this practice. In terms of the other medications like Valium and diazepam and what's another one? Xanax, those effects for relaxation and tranquilization actually get less and less over time when you use these drugs. And so using something like what he just taught you guys, the 4-7-8 breath, the effect actually becomes stronger and stronger. Dr. Andrew Weil in our classes actually used to demonstrate this, and he said that he can't do it too much because he actually becomes very, very somnolent and sleepy. If you do have caretaker strain and you have done everything and now you're starting to really develop the symptoms he talked about, it's very important that you reach out for help and, like he said, not feel guilty.
I had patients in my practice where they're caregivers for either their own children or their grandchildren, and it also makes their chronic pain much worse as well. So when I see a patient like that, I try to deal with their caregiver strain. I try to be very sensitive to it.
It's true. Another really interesting thing about prevention is body mechanics. Body mechanics is how we actually hold our head in relation to our body. My dad taught us that the human head actually weighs 15 pounds. And so if you're chronically on a phone, you see us all like this, it actually puts a lot of strain on those muscles in the upper back. So we had a body mechanics training in teaching you guys how to raise your phone up and look this way so that your head is completely lined up. Remember those Shivas, that you see in the Eastern religions? Shiva is sitting with her head back, the chest is up like a flashlight towards the sky, and her head is lined up completely on the back. It's not forward. So very quickly, if you wanted to know what your body mechanics are, have your friend or coworker take a picture of you standing and then take a picture of you from the side. Very quickly, you can see if your flashlight is up, if your head is up and lined up. That alone helps you look younger, but it also prevents fatigue. And then you kind of put your weight a little bit back on your heels. It's extremely good at prevention of just body mechanic fatigue, because we know that as you're taking care of someone, you just get more and more tired. And so the more you slouch, the more heavy that head is. And pretty soon you'll have back fatigue, neck fatigue, and tension headaches. For those of you that work in a desk job, you're checking your emails, and so you want to look, check the email, and then you turn your chest to one side, put your arm straight back where you can hold it, and then you're going to read that email, see what they had to say, and then answer the email. Click on the next email, turn your chest that way, and then look over, read the email, and answer the email, and then you continue to do that. If you're in the car a lot, driving back and forth, taking care, grab the steering wheels from underneath and then just pull while you're driving, and that alone helps. The second part of this video is about job burnout. It's always a gradual thing, and a lot of times we can prevent it. And job burnout involves you're at your job and you start becoming emotionally exhausted, then you become depersonalized, cynical, then you kind of get inefficient in your job and actually can become incompetent at your job when you used to be competent at it. So this is a very normal human reaction to chronic emotional stress on the job. See what you can do different about it. I know that I recognize it when it's part of my job that a patient's water breaks. And it is now 9 o'clock at night. I was just about to leave the hospital to come home to my husband and 2 dogs. I'm mad that her water broke. You know, I tell my mom, oh, great, her water broke. I was just on the way home to see Jack, which I haven't seen all day, and to just spend time with the dogs. Wonderful. That was really nice of her to break her water. Well, that's a normal part of my job. Why am I mad? Why am I mad that she's going to deliver a beautiful baby? It's because you have emotional exhaustion and fatigue. So don't feel guilty about it, just recognize it.
And she just touched on another subject about job fatigue and burnout, and you see it in physicians, is that they start depersonalizing their job, and really the patients become just an obstacle for them that's standing between them and the end of the day.
Yeah.
You start seeing higher incidence of alcoholism and drug use, which is just the same thing we saw in Caretaker Strain. Approximately 11 years ago, I was on the Board of Healing Arts, and so we saw the effects of physicians who had burnout in their jobs. And unfortunately, the way the effects start to manifest is that physicians start to compensate very well until the very end, and then their job performance starts to drop off precipitously. And so you'll start getting conflicts with patients, you'll start seeing drug abuse, you start seeing inappropriate comments to the patients, even a case of malpractice. And those are the most saddest, because these are physicians that had had really good careers up to this point. But they hit a point because of all the pressures of running their practice, the regulations, and so on. So it could be a variety of things. And it's not just physicians, but even people who have regular jobs as well, especially jobs at which they have little control in terms of decision making. That seems to be one of the top indicators in terms of job burnout. So it's really on the responsibility many times of the managers of these jobs to be able to have programs that are meant to recognize and to address employee burnout and to help treat it.
You yourself can actually calculate your own "Are you burned out?" score. It's called a Maslach Inventory Burnout Score. Real easy, fast screening. To prevent job burnout, you have to have a sense of personal control over your work hours, over your work demands. The other thing that prevents job burnout is also getting appropriate rewards, either institutional, financial, or personal rewards. And that your values line up with the institution's values. Those are extremely good to prevent job burnout. So if you're at a job that there's no way to reconcile these kinds of conflicts, for your own personal health, because as we said at the beginning, chronic emotional stress, it causes inflammation in the brain, which leads to depression. Try to find a different job.
Many jobs already have programs in place. Now, if you find yourself in a job where you really don't have that resource, many of the coping techniques that we were discussing with their Caregiver Strain apply to this as well. And also, too, you have to have social support around you. You just have to remember that we're all human.
I remember Dad used to say, some people are built with engines like Ferraris, like him. Some people are built with engines like Yugos. Yugos was a small car. I think they made that in like the 1980s. And was it Russia?
I think it's
I have an engine of a Yugo. It's a very small car that can't go too fast or too long. Your friends, ask your family, the people closest to you, what kind of engine do I have? They can quickly tell you, oh Mom, you always require lots of naps, you need lots of rest. You probably have an engine like mine. Be yourself and take care of yourself. It's self-care.
Next week, we're going to be talking about integrative medicine approaches to arthritis. We're very thankful that you guys joined us this evening, and we had a wonderful weekend ourselves. We got to attend the Como Wellness Conference in Columbia, Missouri with Dr. Chris Link and Terry Link, and we hope you guys join us next week.